Welcome, Professor Ronan O'Connell. Professor O'Connell is Vice President of the Royal College of Surgeons in Ireland, soon to become its President. In addition, Professor O'Connell is President-elect of the European Surgical Association, which is the corollary and equivalent in Europe to the American Surgical Association. Welcome, Ronan.
Thank you, Stephen.
And most importantly, of course, a colorectal surgeon. And once upon a time, you and I were in training at the same time when we had more hair.
It seems a long time ago, Steve, and you've done much better than I.
I don't think so for a moment. You're very modest. The wall behind you and to your right shoulder attests to it. But nonetheless, I'd like to chat with you today about some of the aspects in surgical training and in the Royal College. And perhaps we could first touch upon the collaboration amongst the four colleges. We spoke a few weeks ago with Neil Mortensen from the perspective, he's your counterpart at the Royal College of Surgeons of England, of course, soon to become at its helm, perhaps he already has. And the question is this type of collaboration amongst the four colleges typical? And if it wasn't typical, as a result of all of these COVID changes, do you think it will become typical?
Well, Steve, the relationship between the four surgical royal colleges is historical and antedates Ireland becoming an independent state nearly 100 years ago. We in the surgical fraternity have maintained very close relationships with the three royal colleges based in the UK. And of course, historically, we have also had a remit for our colleagues in Northern Ireland as being an all-Ireland college. We have probably maintained closer links than the Royal Colleges of Physicians, for example, in that our training programs are done in parallel and are interchangeable, much like you would in North America between Canada and the United States, so that our training is recognized in the UK in surgery, our exams are equivalent, and we have the advantage of having quality assurance and I suppose the oversight to a degree of the other colleges, which helps maintain a very high standard across the two islands.
Thank you. Undoubtedly, COVID-19 caused many changes in the way the college conducts its affairs relative to education. Perhaps you can describe some of the changes that you envision keeping based upon what was done. So both for undergraduate education as well as for the practicing surgeons.
Well, Steve, as you know, RCSI is slightly different from the other surgical royal colleges in that for historical reasons, we developed a medical school and now a University of Medical and Medical Sciences so that we have a dual remit. We're an independent medical university and medical sciences university, as well as being the body that oversees training of surgeons and the profession in Ireland, which would be the equivalent remit of our sister colleges in the UK. In Ireland, we were, I suppose, fortunate in that our government acted a little sooner than they did in the United States or in the UK, and we went into lockdown really about a week earlier than the UK, and that has really dampened the surge so that we've had a high tide, if you like, but have not been overwhelmed. But as part of the coping, all elective surgery was cancelled. And so it may not be a good analogy to talk about a cruise liner in this context, but what we've managed to do is we've managed to stop the cruise ship, get everybody off reasonably safely. But now our real difficulty is getting it going again with a lot fewer passengers and actually some fewer crew as well. And so that the recovery phase is what we're now getting into, and that really is a challenge. With regard to the undergraduate teaching, the RCSI has campuses in the Far East as well as in Malaysia. And we've had a very well-developed system of online education. And there was a business continuity plan that envisaged some challenge to that, and we were able to action that early in February. And so we've managed to complete all of the medical undergraduate education for this year and to graduate our students early. And in fact, the Irish government are bringing in all the interns about 6 to 8 weeks early so that they can help with the staffing of the hospitals. But also, I guess it's to stop people just hanging around, having got their medical degrees and not being able to travel abroad for their traditional holidays. With regard to postgraduate education, we continue to do a lot of our online webinars and tutorials that we already have. We have stopped any classes in the National Surgical Training Center for the moment, but about 90% of our tuition for the current year, which would be July to July, has been delivered. With regard to progression in training, this is something that has exercised all of the Royal Colleges, and we are doing our best to ensure that no trainee will suffer and that they will be able to progress. We are looking for workplace competency-based assessments rather than any OSCE or other examination in order to progress people. And we may be, I suppose, forced to transition to a more competency-based assessment than what has been the conventional assessments.
So speaking of assessments, the Royal Colleges tend to give exams elsewhere. But even when it's at home, an oral examination is often a very important component of getting one's fellowship. Have there been changes yet using formats such as this for video-based examinations?
All examinations are currently suspended across the 4 Royal Colleges until we see how things pan out. There is the intention of starting the MCQ examinations, the first parts of most of the examinations early in the autumn and progressing to OSCE-based assessment. But we may well have to look to do video assessment in case-based scenarios. I believe something like you might do in the American boards, and that competency would be validated by the local training program director. So I think we will be looking to change the model per force because of the travel and social distancing restrictions.
In Ireland, as you say, your government responded a bit quicker than in the UK and elsewhere in the world. You did have the same surge. You're now back to doing non-urgent surgery, as it were. What's been the response of the patients? Because in the United States, we've had a lot of anecdotes about patients not wanting to come into hospital because they've just been told for 2 months how unsafe an environment it is, and now suddenly they're told, come on in, the water's fine. So how are you encountering that scenario in Ireland?
Well, I don't think we're quite back to business as usual. I mean, we really are going to have to accept that COVID is going to be a serious background issue for the foreseeable future. Now, maybe a vaccine will change the paradigm, but that's going to take time. So we are looking within the health service to create a COVID-free pathway where we can. And a lot of work is going into how we can triage patients, ensuring that they self-isolate, that they have PCR testing, and that they go through this questionnaire for symptoms. And likewise for staff, we cannot allow a situation where a patient will come in electively for a big procedure, they're COVID-free, and they get COVID in the post-operative period, because the outcomes for that are really serious. So we're working on those clinical pathways, and that's quite a bit of work to develop clinical pathways. We, as you know, have principally a publicly funded system, a bit like the NHS in the UK. It's called the HSE. And we have, like all publicly funded healthcare systems, we have been running very close to the wind in terms of the facilities. And the question now is, for example, we have over the 3 months effectively of lockdown, we will have had 1,200 gallbladders, 1,000 hip replacements that haven't been done in our system. So how do we bring these in safely and accommodate them along with the 1,000 that are going to be generated every couple of weeks here anyway, in a system that was already under stress in terms of capacity? One of the issues is that maybe we need to go to a longer working day, a 16-hour day rather than an 8 or 12-hour day. We may need to do 7-day-week operating electively. But the finances of that are tricky, because it's not just good enough to have the surgeons in, you've got to have a full staff in order to deliver that kind of service. So these are the kind of questions that are exercising us now.
What's been the use of telehealth in Ireland? In the US, we had obstacles because of HIPAA and regulations, which platform we could use, payers weren't paying. But what was the status of telehealth for surgeons prior to, and what is it now?
Well, prior to, telehealth really existed only in very small areas of general practice. We have been catapulted into the need to conduct outpatient consultations by phone. And I have no doubt that it will completely change the way we do outpatients. The idea of having the traditional outpatients with 30, 40 people sitting outside like you would to get on a plane, that's gone. And you will have timed appointments for selected people, but most of the work will be done where it can be done, will be done by telemedicine. But again, that has huge training implications. It has medical legal implications, and it has resource implications, as well as privacy and all of that. So we're working through that, but I have no doubt it's going to change things.
Yes, I appreciate your insights in that direction, and certainly we're battling with the same issues here, where people deciding how to stretch out hours, how to stretch out days, interspersing telehealth visits with regular visits, and all the like. One thing that I've heard might be a little different in Ireland and in the UK than elsewhere is looking out for older staff. I've spoken to some people who said, no, they told me not to come in because I'm a high-risk group, I'm over 65. Could you let us know a little bit about how that's worked out?
Well, I don't know who brought in the term cocooning, but we certainly have, the government made a very strict recommendation that anybody over the age of 70 would cocoon at home and not leave their home for the last 6 weeks. So, for example, my 88-year-old mother-in-law, we've been just delivering her groceries and things like that, but she hasn't been out for 6 weeks. That restriction is about to be lifted next week, all going well. With regard to the over 60s, for the most part, they have been kept out of COVID hot areas. And the advice is that the over 60s should not engage in high risk areas where they might become infected. That being said, although we have had about a quarter of the 25,000 cases in Ireland have been healthcare professionals, we have been fortunately spared the very high mortality that has been reported. Most of those who have succumbed have been over 80 and have had other healthcare issues. But we have lost a couple of healthcare professionals over the last couple of weeks.
And one last question about meetings, and we spoke a little bit about this already. but you have regularly scheduled meetings, obviously, for educational purposes. Through what period of time, today being May 12th, but through what period of time have regularly scheduled meetings in Ireland and in Europe been canceled? I know we missed European Surgical Association already, and ESCP, I believe, has already been canceled, the Association Colopartology Great Britain Ireland. How long out has the cancellation stretched?
There's no absolute guidance regarding that. In the UK, people have been advised that nothing before November 1st. We've already cancelled a big meeting, the FREYR meeting in Galway. I'm not sure if you've ever attended it. I think you have. That's the first week in September. And we have the Millen meeting, which is a major college meeting commemorating Terence Millen, the urologist, in November. And we think we will be cancelling that as well. So effectively, I don't see any major meetings occurring until the new year.
Interesting. I think FREYR was also a urologist, if memory serves correct.
You're absolutely right. Yes.
I remember looking him up when I had to do my acceptance speech. So you're paying a lot of homage to your urologist in Ireland.
Well, you get to a certain age, Steve, and maybe.
All right. Well, any other parting comments or reflections for us?
I have to say I pay tribute to all my colleagues, my surgical colleagues, the trainees and the nursing and extended healthcare professional who have got us through this. My own wife, Pauline, who you know, has just done a 12-hour shift in newborn intensive care. And it's really arduous wearing all this PPE. We've been fortunate that Ireland, though there have been shortages, we've managed not to have the dramatic difficulties that has happened elsewhere. But it really is tiring, and we need to look after ourselves. There will be a lot of burnout. And I think as we relaunch surgical services, we've got to be very aware of the effects that it's going to have had on the people who've kept us going for the last 6 or 8 weeks.
Thank you very much, Ronan. I really appreciate your time and your thoughts shared with us this morning. Congratulations on your soon-to-become presidency of the Royal College of Surgeons in Ireland, and I hope to see you perhaps not until the new year in person. In the meantime, stay well, you, Pauline, and the rest of the family.
Well, Steve, it's been a great pleasure, and I look forward to meeting you at least in the new year, if not before.